Merci. Thank you. Good morning, or afternoon now, actually. Just want to start off with a couple of things. We want folks to know that we are excited that we were able to pass the first of its kind paid sick leave for Canadians. This is a massive step forward, a massive victory for people, and we're proud that we were able to make that happen. We're going to keep on fighting. There's a lot more that we need to do. We know people are worried about their loved ones in long-term care homes. We need to make sure our healthcare system is there for people. Testing remains a top of mind issue. And the question keeps on coming back, how are we going to continue to pay for these programs? And I want to be very clear, it should not be you. People at home struggling to make it, who are worried about how they're going to make their bills, people that have faced the pain of this pandemic, small businesses. You should not be the ones that have to pay for the cost of the recovery or the programs right now. It should be those who have profited, because there are the ultra wealthy in Canada who have made record profits during this pandemic. And those should be the ones that are paying for the cost of this recovery, and for the pandemic, the ones who've profited off it. So that's really important. Donc, on est tellement fiers du travail qu'on a fait. On a réussi à accomplir quelque chose qui est historique, le fait que maintenant on a une congé de maladie payée fédérale. C'est la première fois d'avoir quelque chose comme ça dans l'histoire de notre pays. Et on sait qu'il y a toujours des inquiétudes qui continuent, et je veux vous assurer qu'on va continuer de se battre pour vous. On sait qu'il y a des inquiétudes avec nos aînés dans les centres de soins de longue durée. On a des travailleurs et travailleuses qui continuent d'avoir des inquiétudes, et les tests sont tellement difficiles, donc on va continuer de se battre pour vous. Mais la grande question qui arrive, c'est qui va payer le prix pour la reprise. Donc, ça ne doit pas être vous, les travailleurs, les travailleuses, monsieur, madame, tout le monde, qui doit payer le prix. C'est eux qui ont fait des grands profits qui doivent payer le prix. Donc, les autres riches, les grandes entreprises qui ont eu des profits records, c'est eux qui doivent payer les prix. Donc, ça, c'est une autre priorité. Donc, je suis prêt pour vos questions. I'm ready for your questions.
Well, now we'll go to questions, starting with questions on the phone. Quick reminder, one question, one follow-up. Nous allons maintenant passer aux questions. Commençons par les questions au téléphone. Petit rappel que c'est une question de suivi. Operator, do we have a first question?
Thank you. Merci. The first question, Marie Walsh, Global and Mail. Please go ahead. La parole est à vous.
Hi, Mr. Singh. I'm
Hi there.
hoping on a different topic you could give us your take, or the NDP's take, on the government's plastic ban that they announced today that will come into effect next year, as well as their plans to increase recycled content in plastics and to move towards zero plastic waste by 2030.
Thanks for the question. This is something that New Democrats have been long fighting for. You'll recall Gord Johns had a really specific piece of legislation on this in the last session. He'd fought to protect oceans. And as someone from Vancouver Island cares deeply about the oceans, his community is deeply connected to the ocean. So this is something that we strongly believe in, that we need to ban single-use plastics, that we need to protect our oceans. And we need to make sure as a society we're designing our economy in a way where it's circular, where we're not creating waste products that will last forever. And something that's meant to be thrown away to be built in such a way that it lasts forever does not make sense. And so we strongly support this. Alexandre aussi, un député du Québec, était tellement fort sur cet enjeu qui a voulu voir cette introduction de plastique à utilisation unique fois. So this is something very much within our values, and we're encouraged to hear this. We're not certain this is going all the way yet. We have to look at more of the details as it rolls out, but this is certainly a signal of something that we've long called for.
So just so I'm clear, you support the goals, but you are still assessing the plan to see if it actually meets the goals. Is that fair to say?
Very fair to say. Yes, we absolutely support the goal. This is something we've called for. Like I mentioned, our members of parliament have been actively pushing for this, and we want to see our environment protected. We want to see waste products that are going to last forever no longer used. It doesn't make sense for us to be using plastics as a throwaway that will remain in our oceans and on our planet for forever. I mean, that doesn't make any sense. But we want to see the details before we commit to supporting.
Opérateur,
Great, thank you.
Thanks.
Opérateur, prochaine question.
Merci. Thank you. The next question, la prochaine question, Lina Deep, la presse canadienne. À vous.
Oui, bonjour, Monsieur Singh.
Bonjour.
J'aimerais donc entendre plus clairement ce que vous pensez de ce plan-là. Les environnementalistes, Greenpeace entre autres, sont déjà sortis pour dire que c'était insuffisant, les 6 produits choisis, tout ce qu'on taxe sur tout ce qu'on met comme poids sur le recyclage, que ça sera pas assez, ça fera pas la job. Alors, au NPD, on pense quoi de ce plan qui a été annoncé par Monsieur Wilkinson ce matin?
Donc, le principe, c'est quelque chose qu'on appuie, l'idée d'interdire l'utilisation de plastique à unique fois. C'est quelque chose qui a aucun sens de faire parce que ça a un impact négatif sur l'environnement. Et c'est exactement ça, les détails. On va évaluer les détails pour donner notre position sur leur plan. Mais en général, le principe, c'est quelque chose qu'on appuie, mais on a des inquiétudes toujours avec les libéraux qui disent une chose, mais les détails ou ce qu'ils font, ce n'est pas exactement le même que ce qu'ils ont proposé.
Bon, ben, si je peux me permettre, c'est parce qu'ils ont dit ce qu'ils allaient faire ce matin. Mais je comprends que vous n'avez pas eu le temps de regarder exactement c'est quoi leur plan. Mon autre question est sur un tout autre sujet, sur l'aide médicale à mourir et sur d'autres questions d'ordre, disons, moral. Les conservateurs ont décidé qu'ils laisseraient leurs députés voter selon leur conscience. Au NPD, est-ce que ça va être des votes whippés ou est-ce que chaque député votera selon sa conscience sur l'aide médicale à mourir et sur d'autres éventuels enjeux de la sorte?
Donc, avec la question de le droit ou le médicament mourir, c'est quelque chose qu'on a déjà appuyé comme parti. C'est quelque chose qu'on va continuer d'appuyer. Et avec ce qu'on a entendu comme critique, c'est le fait qu'il y ait accès à ce droit, ce n'est pas suffisant. Et c'est quelque chose qui a été soulevé à plusieurs reprises. Et on veut s'assurer que ce droit est vraiment accessible. Ce choix, c'est un choix difficile, mais ça doit être ouvert aux gens qui veulent le prendre. Sure. On the medical assistance in dying, it's something that New Democrats have supported, will continue to support. Our major concern is what's been raised by people, that though this is a very difficult decision to make, people need to have access to this right, to this decision. And the concern we've heard from people is the access is not there. There's not enough access, and it's limited in its scope. Similar to a decision that came out of Quebec that the scope is limited, we believe it should be a choice that is accessible.
Opérateur, prochaine question.
Merci. Thank you. The next question, la prochaine question, Émilie Bergeron, Agence QMI. À vous.
Bonjour, M. Singh.
Bonjour.
Dans l'annonce de ce matin des libéraux sur le plastique à usage unique, on compte beaucoup sur le recyclage, mais on n'a pas de marche à suivre ou des objectifs à travers le temps pour augmenter le taux de recyclage, qui est seulement à 9 % en ce moment. On sait qu'on va arriver à 0 déchet plastique en 2030, mais dans l'intermède, on ne sait pas exactement c'est quoi le plan. Est-ce que vous avez une idée de ce que devrait être l'objectif du Canada?
Oui, l'objectif, ça doit être le fait qu'on a une économie durable. Ça veut dire une économie où on ne crée pas des déchets et où on a une économie circulaire. Si on crée quelque chose, on le réutilise. Donc, ça doit être notre but. Et le problème avec encore la proposition du gouvernement libéral, c'est le fait que toujours, ils disent une chose et ils font quelque chose qui n'est pas semblable avec leurs mots. Et encore, en principe, on appuie l'idée de recyclage, on appuie l'idée d'interdire l'utilisation de plastique à unique fois. Mais on a toujours des inquiétudes avec les détails de leur plan et comment ils proposent d'atteindre ces buts.
La COVID-19 a amené plusieurs restaurateurs à utiliser des produits du plastique à usage unique, comme des ustensiles, par exemple, pour répondre aux mesures sanitaires, pour réduire les risques. Est-ce que vous pensez que ça va poser un défi supplémentaire?
Je crois qu'il faut, on doit avoir une exception pour les questions sanitaires pour médicaments, les outils qui touchent tout ce qui est pour la santé. Ça, c'est une exception claire, mais pour plusieurs exemples, on n'a aucun besoin d'avoir l'utilisation de plastique. Donc, dans les cas où ce n'est pas nécessaire, il doit les interdire ou trouver une solution qui est circulaire, une économie circulaire. Mais avec les questions de santé, des médicaments, les choses qui touchent la santé, on doit avoir une exception là pour garder la santé.
We'll now take questions from the room. Nous allons maintenant prendre des questions dans la salle. David?
Yes, David Thurton, CBC News.
Hi there.
Are you satisfied with the government's announcement yesterday about, their proposal, their plans to buy these rapid testing machines? Is that enough? Do you think we're moving in the right direction with that?
So the big concern here is that there are wait times that are in multiple hours. There are massive waits for families that need to get tested, and that is a serious concern. There needs to be far more effort placed to ensuring people can get tests, get them rapidly, and get them done in a convenient and easy way. My concern when it comes to the questions around testing, first off, is that we cannot allow space to be open for a two-tier healthcare system where there are private clinics providing testing. That to me is completely the opposite of our values in a universal healthcare system. Everybody needs to have access to healthcare, no matter what they earn or how much they can pay. That has to be a principle that we protect. And so when it comes to testing, we need to make sure there's the right funding placed for the highest quality tests and that people can access them. And I want to encourage our decision making around which tests are approved on two principles. One, what's in the best interest of Canadians, and two, what protects our universal public healthcare system.
And just on today's announcements about plastics, I know you still have to look at the details, but do you have any concerns that perhaps what was announced today did not go far enough, or is going too far, or we need to be a bit more aggressive?
We absolutely need to be very aggressive with use of plastic, particularly in commercial purposes, that there is no connection to health or healthcare concerns or sanitary concerns. When it's strictly packaging, that there is absolutely no benefit, and it is plastic that's being used that will never be able to break down. There's something clearly wrong with that. We need an economy that's circular, where whatever we produce, we reuse, or we ensure we're not producing products that are meant to be thrown away that cannot break down and end up in our oceans and our rivers and our streams in the earth. Those things have to stop. And so I'm concerned, though, that the Liberals' proposal, on one hand, the principle of it is something we support, but we're always worried about the details and whether they're actually going to achieve the goals. And there's already been some concerns around that. And so we're going to look very closely at the details before indicating if it's something that's good enough. My concern always remains, though, that Liberals will make a great announcement, but they don't back it up with the real actions required.
Glenn?
Glenn McGregor, CTV News. Mr. Singh, further on plastics, are you concerned, though, that this is maybe not the right time to do this? Because small businesses are struggling right now, especially small businesses in the restaurant space that are trying to transition to takeout. Plastic is a key component of that. Starbucks and other larger corporations can move en masse, but your mom and pop coffee shops and shawarma shacks and whatever are going to still depend on this as an integral part of their business. I think maybe the timing is maybe not right here.
Really fair question. I think what we can do is provide supports for those businesses to make that transition. I mean, this is something essential. It's very important. If we make this a policy decision and we assist those businesses in making that transition, consumers want this. People want to know that they're making the right decision when they're buying their food at their favorite local restaurant. They want to be able to know that the takeout that they're buying is something that's not going to hurt the environment. So this is something in the interest of everybody. But there's absolutely some supports that need to be there. You're right when you mention, the larger chain restaurants might have a larger supply chain and an easier buying power to be able to make that transition. But we have to acknowledge that there should not be waste that is designed purposely to last forever that's just going to be thrown away. That is something we have to react quickly, and there's ways for us to make sure we encourage people and companies to be able to make that change. There are certain exceptions, though, given the time we're in with COVID-19, and that's around anything touching healthcare or touching protection of someone's health. I think in that area we need to be very careful about exceptions.
Just following on your response to David on testing, Prime Minister said yesterday that he's asked his health minister to look into the issue of people effectively jumping the queue and getting private tests by paying, including some members of Parliament who can go to Gatineau and get tested for $200, paid for by the House of Commons. Just curious what you think the response from the health minister should be on this, and how do you crack down on this? How do you stop it?
It's a good question. I think first of all we have to acknowledge that it needs to be cracked down on. Like there is no way in our universal healthcare system there should be a door open to private testing when this should be a publicly available. This is a public health emergency, and everyone should have access to testing. So I think about we heard a really powerful example from Carolyn McIsaac, a woman that was interviewed about this very question. She had waited hours in a lineup with 2 kids, twins, 4 years old, and she had waited for hours. And at the end of it, people asked, what if private testing was an option for you? Would you have considered that? And I think it's really powerful that after waiting for many hours in line to get her kid tested, she still said, no, that is not the solution. Like Canadians believe in public healthcare. She said it should be equal access for everyone when it comes to testing. So we need to make sure this is very clear. This is an opening for a 2-tier healthcare system. We cannot allow it. And how we crack down on it, there's many tools that we have at the federal level. The commitment has to be there to protect our healthcare system and keep it universal so that everyone gets access to the highest quality care, no matter what they earn, no matter what they can pay. That has to be a principle we protect.
Quick follow on that. Have you had a test? If so, where did you do it and how was it?
Yes, I had a test, and I waited in line at a public testing facility. It was in Toronto.
And I'm guessing just really quickly, that was a negative test?
It was a negative test, yes.
As I'm standing here asking you a question. So, Mr. Singh, I want to just go back.
I'm not Mr. Trump. Yeah, I can get you the exact date if you like. It was earlier in the summer. Okay. So it was before the massive lineup. So mine was only I waited. I shouldn't do this. Sorry. I waited an hour and 15 or so. So yeah.
Okay. All right. Well, on that note, I want to ask you just go back a second to the assisted dying legislation, because you expressed some concerns about it. Can you just tell us, I know Mr. O'Toole has said how it'll likely be a free vote on the assisted dying legislation and the conversion bill in his caucus. I'm curious how the vote then you expect to play out in your caucus, if it'll be whipped or if it would be a free vote for everyone.
No, the conversion vote is going to be everyone voting against or voting to ban conversion therapy, and we will all be voting together. And similarly with the right to medical assisted dying, something that New Democrats have supported and will continue to support. We don't know in terms of the legislation if it will go where it needs to go, but the principle is we believe everyone should have access. We believe everyone should have access to this important right. And the question that's been raised in courts and the question that's been raised by people is that there's not enough access, that people who need to make this choice can actually make use of it. And that has to be something we change.
Maybe just very quickly as the last question, you talked about sick leave off the top. There's the Parliamentary Budget Officer has put out some new numbers today about who is likely to access it and for what reasons. And it seems that very few would actually access it because they have COVID-19. I'm just curious how then you see this sickness benefit playing out over the next year, and if this is something that needs to become permanent, just given that it seems like the majority of people would actually use it for non-COVID related reasons.
Well, we absolutely believe this should be the building block or the first brick in a foundation for a permanent paid sick leave. Absolutely. Like we're in a time now, maybe in the past, and like I might be guilty of this, that we would think it's, you got to go into work sick, you got to be tough it out. But it's not the responsible thing to do. In a pandemic, we've learned, like you can't really tell. Like if you've got symptoms that feel like a flu, it might be COVID-19. And no one should have to make that tough choice. I've got some symptoms, I'll just go in. They should just stay at home. But how can someone stay at home if by staying at home, they're not going to get paid, and it means that they're not going to be able to make their bills? Like that just cannot be a question or an impossible decision that any worker has to make. So paid sick leave is something that should be a permanent fixture, and we're really proud that we were able to bring it in now, and we're hoping it's a starting point for Canadians to see how good this is and then we want to establish this as a permanent program.
This is all the time we have. Thank you so
Okay,
much. The
thank you.
conference is now over.
Thanks for the 3 glasses of water. Cheers.